Welcome to the MediByte channel. I'm so glad you're here for this explainer because today we are talking about your body's ultimate check engine light, the menstrual cycle. As a healthcare professional, I'm constantly telling my patients that their cycle is literally one of the most powerful indicators of their overall health. When that light starts flashing, whether your periods have just stopped entirely or they've become overwhelmingly painful, it's your body's way of trying to tell you something absolutely crucial. So we're going to decode those signals today in a complete, detailed, and easy-to-understand way. To guide our exploration, we've got a great roadmap for today. We'll be covering the menstrual cycle's natural rhythm, primary and secondary amenorrhea, diagnosing and treating those conditions, dysmenorrhea, and finally, how to take charge of your health. Section 1. The menstrual cycle's rhythm, the body's monthly relay race. Because hey, before we can understand what goes wrong, we really need to know what right looks like. Think of your hormones like a massive relay race happening inside your body every single month. It actually all starts right up in the brain. The hypothalamus, kind of like the main control center, signals the pituitary gland. The pituitary then passes the baton down to the ovaries, basically telling them, hey, it's time to produce estrogen and progesterone. When this whole sequence works perfectly and there's no pregnancy, the uterus sheds its lining and you get a menstrual period. It is just a brilliant, incredibly delicate balance. But what happens when this delicate relay race gets interrupted? Well, we experience amenorrhea. That's the medical term for the complete absence of menstrual periods. Now, obviously, this is entirely normal during pregnancy or while breastfeeding or after menopause. It's also perfectly normal before puberty. But outside of those specific expected times, it is a vital warning sign that somewhere along the line, the communication between your brain and your ovaries has just completely broken down. In the medical world, we actually categorize this condition into two totally distinct paths based on your personal history. First, there's primary amenorrhea, which is when menstrual periods never start in the first place. And then there's secondary amenorrhea, which happens when a woman has been having regular or even irregular periods and then they just suddenly stop. Now, secondary is much more common, but let's take a quick look at primary first. Section 2, primary amenorrhea, or missing starts. While it's relatively uncommon, sometimes foundational structural or genetic factors can actually disrupt the whole system before it can even establish a rhythm. This might be due to a genetic disorder, like Turner syndrome, or part or all of an X chromosome is missing, or Kallmann syndrome, which involves a sharp decrease in female sex hormones. In other cases, the hormonal system is actually firing perfectly, but a physical birth defect, like an imperforate hymen, physically blocks the menstrual blood from leaving the body. And, sometimes it's simply a case of delayed puberty that naturally runs in the family. So how do you know when to worry? Well, there are exact chronological milestones for when you should consult a healthcare professional. You really shouldn't just play the wait-and-see game forever. For instance, if there are absolutely no signs of puberty, like breast development by age 13, that's a solid reason to see a doctor. Or if it's been 3 whole years since breasts began to develop and there's still no period, definitely see a doctor. Or if a girl is growing normally but hasn't had a single period by age 15, it's absolutely time for a medical evaluation to figure out exactly what's holding up the process. Section 3, secondary amenorrhea, or sudden stops. If you're missing periods and you know for a fact you aren't pregnant or breastfeeding, well, this is exactly where we start looking. Why does the system malfunction? It's a really great question, and it leads us directly into a myriad of physical, lifestyle, and medical factors that can trigger this disruption. Aside from well-known conditions like polycystic ovary syndrome or PCOS or premature menopause, one of the biggest culprits is actually your hypothalamus misfiring. Extreme stress, undernutrition, or really intense athletics can actually force your brain to just slam the brakes on your cycle. Think about it. If you're struggling with an eating disorder like anorexia or bulimia, or maybe just taking in way too few calories from intense dieting, your body goes into full-on survival mode. The exact same thing happens with excessive, competitive exercise or severe emotional stress and mental disorders. Your brain essentially looks around and decides, hey, right now is definitely not a safe time to support a potential pregnancy, so it just shuts the entire reproductive system down. It is also incredibly fascinating to see how everyday medications can completely unintentionally pause your cycle by altering your hormone and prolactin levels. Prolactin is the hormone that normally stimulates breast milk production, right? But super high levels of it can totally stop your periods. Everyday medications, ranging from antidepressants and antipsychotics to heavy opioids, can artificially spike your prolactin. And other medications, like synthetic male hormones or high-dose progestins, can also disrupt that delicate balance, leading to missed periods and, in some cases, even the development of masculine characteristics. Which brings us to Section 4, diagnosing and treating amenorrhea, or reading the signs. If you're experiencing any accompanying symptoms alongside your missed periods, your body's check engine light is officially flashing red. This signals a real need for blood tests or imaging. For example, if you're seeing excess body hair or a deepening voice, that points toward hormone imbalances like PCOS. Experiencing vision problems or wicked headaches, that could actually suggest a benign tumor on the pituitary gland. And spontaneous milky discharge from the nipple points right back to those elevated prolactin levels we just talked about. These are the exact clues that guide your doctor on whether to order an ultrasound, a blood test, or even an MRI. Once the root cause is finally identified, treatments focus heavily on restoring ovulation and preventing long-term damage. If a thyroid disorder is causing the pause, we simply treat the thyroid. If there's a structural blockage, minor surgery can usually resolve it. But a massive, absolutely crucial priority for your healthcare provider is making sure your body has enough estrogen. A long-term lack of estrogen doesn't just stop your periods. It severely decreases your bone density, leading to osteoporosis, and significantly increases your risk for heart disease later in life. We really want to prevent that. Section 5, dysmenorrhea, or painful menstrual cramps. Okay, let's flip the coin and look at the other side. What happens when the rhythm is present, but it's overwhelmingly, disruptively painful? In the medical world, we call this dysmenorrhea. Listen, if your periods are keeping you home from school or work, I need you to know that you are not alone and it is not just normal cramps. Up to 30%, or sometimes even more, of women experience dysmenorrhea that is severe enough to genuinely interfere with their daily lives. The other 70% might have mild, manageable symptoms, but that 30%, that's huge. You do not have to just grit your teeth and suffer through it. Now, there's a really important, clear distinction between pain caused by natural chemical contractions versus pain stemming from underlying diseases. Primary dysmenorrhea usually kicks off in adolescence. It's caused by high levels of prostaglandins. These are essentially substances that make your uterus contract heavily, which reduces blood flow and makes all those nerve endings super hypersensitive to pain. Secondary dysmenorrhea, on the other hand, usually starts much later in adulthood and is caused by an actual physical abnormality in the reproductive system. Conditions causing secondary dysmenorrhea definitely require a medical evaluation to stop the abnormal tissue growth. Take endometriosis, for example. That's when the tissue that normally lines the inside of your uterus decides to grow outside of it. Or adenomyosis, where that tissue grows deep into the uterine wall itself, causing it to swell and ache terribly during your period. Fibroids, which are non-cancerous tumors, can also cause heavy pressure and severe pain. And honestly, even a non-hormonal copper IUD can sometimes be the main culprit here. So when does cramp pain become an emergency? Well, there are specific alarming symptoms that act as urgent indicators that you need to see a doctor the exact same day. If your cramps suddenly start alongside a fever or pus-like discharge, or if the pain is completely constant and sharp when your abdomen is even gently touched, those are huge red flags. We start worrying about serious inflammation or pelvic infections that need immediate, same-day medical attention. But for standard dysmenorrhea, your healthcare provider actually has an entire arsenal to help you out. It starts at timed anti-inflammatories and can range all the way up to hormonal therapy or minimally invasive surgery. Now, here's a massive pro tip, right from the medical guidelines. If you use NSAIDs like ibuprofen, start taking them 24 to 48 hours before your period even begins. That helps you get ahead of those pain-causing prostaglandins. If that trick fails, hormonal contraceptives that completely prevent ovulation are incredibly effective. And for structural issues like fibroids or severe endometriosis, specialized surgery can offer immense, life-changing relief. Section 6. Taking charge of your health and your next steps. You now have the vocabulary and the baseline knowledge to really advocate for yourself in the doctor's office. Your cycle really is a vital sign. What is your body trying to tell you today? Whether it's a total absence of periods or truly severe pain, please never ignore the signal. Seek out the support and the proper diagnosis you deserve. Remember, an absent period isn't just a convenient little break from menstruating. It's a loud, clear sign that your bone health and overall hormonal balance might be at risk. And agonizing cramps, they are not just some burden you have to bear silently. Thank you so much for joining me for this explainer. Please like, share, and subscribe to the MediByte channel to keep learning with us. We are so dedicated to bringing you structured, clear, and comprehensive health insights. Until next time, Keep listening to your body and take care of your health.